this side, right? Oh, can you move this? Okay. Like this. Okay. Should I just start? Should I stand here? Yeah, okay. Okay. Assalamu alaikum, everyone. Can everybody hear me? Yes. Okay. So my name is Dr. Aisha Qureshi. I am a licensed naturopathic doctor and nutritionist. And today I'm very excited to be talking about a topic that I think is very, very important, which is the topic of metabolic syndrome. It is a condition that has been growing increasingly worldwide. It's really prominent in the Muslim community as well, in the South Asian community. It's growing in Canada. So I'm really passionate about this topic, and I think one of the best things is if we understand a little bit more about metabolic syndrome. Okay. So if we understand, oh, sorry. So if we understand a little bit better about metabolic syndrome, we can use the tools to help prevent it. I think we might need to adjust the mic. Is this better? I feel like it's the same, but it's better. Okay. So we're gonna, just from a show of hands, I wanted to know how many of you guys have heard about metabolic syndrome? Okay. Okay, so not a lot of you. So I'm actually more excited now to go through a little bit about the pathophysiology, what the disease represents, how you can prevent it, and inshallah, you stay healthy and don't get any of the risk factors for it. So we'll begin just by going through a little bit about me. So I became a nutritionist in 2010 when I graduated from the University of Toronto studying nutritional sciences. So I've always been very passionate about nutrition, which got me interested in naturopathic medicine. And I've been a naturopathic doctor since 2015. So I've been in clinical practice for a little bit over 10 years now. I have both an in-person practice at the Muscle and Joint Clinic, which is a multidisciplinary clinic. I also have a virtual practice for Ontario residents. My clinical focus is a lot on women's health, so I do a lot of hormonal support, fertility support, pregnancy support. I do a lot of metabolic health, which is why this topic in particular is very important to me. So I do a lot of diabetes management, cholesterol management, hypertension, and because I work at a pain clinic, I do specialize in pain management as well. So we will actually go right into the topic. So I wanted to start by just defining what metabolic syndrome is. It's a group of conditions that together increase your risk factors for cardiovascular disease, type 2 diabetes, and stroke. The diagnostic criteria is 3 of the following 5. So it includes high blood pressure, high fasting blood sugar, excess belly fat or abdominal obesity, high triglycerides, and low HDL cholesterol. So if you have 3 of any of these 5 conditions, you meet the criteria for metabolic syndrome. So based on this criteria, you can see, in fact, how many people actually have it, but probably don't know that it's called metabolic syndrome. So we are actually going to go through all of these individually, understand them a little bit better, go through the pathophysiology of it, and then the prevention steps that you can take to not progress in that condition. So why does metabolic syndrome matter? It matters because of how far it's growing. So 1 in 4 adults may have metabolic syndrome in Canada. 20 to 30% it's prevalent in the South Asian population and around 25% in the Middle Eastern population. Now these percentages are pooled averages. So depending on which area you are specifically, for example, in the Middle East, Saudi Arabia has a higher percentage than a country like Jordan. So there is a little bit of variation in that number. And same thing in South Asian population. So same thing in the South Asian population, there is small variations, but regardless, it's about 1 in 4, which is a lot. And the reason why it's so important to talk about is because it can raise the risk for heart disease, stroke, and type 2 diabetes. And when you have any of these, if you've had a heart attack or if you've had a stroke, or if you know somebody that has had a heart attack or stroke or has complication in diabetes, you know the burden on the quality of life and the long-term health consequences it can have. So that is why I, in particular, am very interested in it, because it is, to a certain degree, preventable and reversible with early intervention. And so as a naturopathic doctor, our focus is a lot on prevention. I really like this web diagram, which really does exemplify how interconnected metabolic syndrome is. So if you look here on the outside of the circle, you're seeing all the conditions I previously talked about, so high blood pressure, high triglycerides, low HDL, cholesterol, chronic inflammation, and abdominal obesity. And you can see that one actually can influence and increase your risk factor for the other. So for example, if you have abdominal obesity, it actually sends inflammatory markers and can increase chronic inflammation in your body. Chronic inflammation can therein cause low HDL cholesterol, and it's also the other way around. Low HDL cholesterol can actually increase inflammation in the body as well. Triglycerides and insulin are actually very tightly regulated in the body, and they're very, one can influence the other. So if you have insulin resistance and you're having high blood sugar, you actually can be a risk for developing high triglycerides as well. So as you can see, it's very much interconnected, but all in all, through that relationship, it increases your risk for heart disease, type 2 diabetes, and stroke. This diagram I put in so we can get more of the pathophysiology of what's exactly happening in metabolic syndrome. So if you look at this in the middle, it's showing someone with abdominal obesity along with high blood glucose. And then it shows how those two things alone actually can increase inflammatory markers. So TNF alpha, IL-6, IL-1 beta, these are all inflammatory markers that are released from your cells when there is inflammation. Over here shows what that means. So a normal cell doesn't have, should be able to fight off oxidative stress. So we all talk a lot about antioxidants and why they're important. It's literally for this part of the cycle in your body to help reduce oxidative stress at the cellular level. Over here shows more of the insulin resistance picture. So insulin's job is to control blood sugar in your blood. It also shows how if you have excess sugar, it can actually get converted into triglycerides and VLDL, which is fats in your blood. Adipose tissues, which are fat cells, also increase inflammatory cytokines. And so both of these things together, so insulin resistance and oxidative stress, they actually overall increase chronic inflammation in the body. And what that does is this at the bottom shows what happens at the level of the artery. So over here, you're seeing, because of inflammation that's caused by all these factors going on, you're seeing plaque formation. And plaques can increase your risk for heart disease, for blockage, and for stroke. So what are the root causes of metabolic syndrome? So these include things like having a sedentary lifestyle, so not being physically active, not exercising is a risk factor. Your diet can play a big role, so a diet rich in processed foods, high in sugar, high in saturated fats is another risk factor or a root cause of metabolic syndrome. Chronic stress is a really big factor because it relates to increase in cortisol. So cortisol is our stress hormone. From a physiological perspective, cortisol is actually very important. It teaches your body the flight and fight response. But when it's chronically elevated, that's when it causes havoc in the body. So that can, it can increase your blood pressure, it can increase your blood sugar. So this is actually one of the root causes of metabolic syndrome, especially in North America. Poor sleep is one that's actually often overlooked. Sleep is so in terms of management, it's something that I focus a lot on in my practice because sleep is the root cause of poor sleep is the root cause of so many conditions. It can influence your cholesterol levels. It actually can increase your risk of weight gain, which a lot of people don't realize. So if I have patients that come in and they have, they're trying all these weight loss regimens, but they're not losing weight. And then through my investigation, we find out, well, they're sleeping like 3 hours a day or they're not getting good quality of sleep. So sleep is something that I focus a lot on to improve the quality, improve the duration. Hormonal imbalances. So hormonal imbalances include everything from insulin, thyroid, cortisol. It also includes like hormones such as estrogen and progesterone. So hormonal changes we know can influence the cause of metabolic syndrome. In men, low testosterone can also influence the cause of metabolic syndrome. And one of my favorite ones that I love talking about is this one right here, the genetic susceptibility. So I just want another show of hands. How many of you guys have it in your genetics or maybe in your parents' genetics, the conditions of diabetes, high cholesterol, and high blood pressure? Okay, so it's one of those things that is very common. And I always love having discussions with my patients because it's always an opportunity to tell them that even though things might be in your genetics and they're increasing your risk factors for it, you actually do have control over diet and lifestyle, along with some supplements, along with medication, can actually reduce your risk factors for disease progression. So who's most at risk for metabolic syndrome? So if you're the age of over 45 years old, if you're overweight or obese, if you have family history of diabetes or heart disease, in women, if there's a history of gestational diabetes or PCOS, that can increase their risk factors for developing diabetes later on in life, and diabetes, because it's part of metabolic syndrome, it increases that risk altogether. And then being part of the ethnic backgrounds of South Asian, African, or being of Hispanic descent. So as a naturopathic doctor, my approach to treating metabolic syndrome might be something new because it's a little bit different than conventional medicine. Naturopathic medicine, one of the main philosophies, and it's one thing that I absolutely love about the profession, is that we're really root cause focused. So as we saw earlier, we were really trying to figure out all of the root causes that can contribute to the development of, for example, diabetes or high blood pressure. When you're looking at the root cause, you're seeing the system as a whole. So you're taking things into account of stress, sleep, diet, lifestyle, and then we're looking at that all together. And so the treatment and management strategies that I talk with my patients about, it's a lot of lifestyle counseling, so a lot of nutritional therapy through diet, a lot of lifestyle coaching through targeted exercises. There's a whole line of supplements and herbs that I go through with my patients, and everything is very individualized to each person. Naturopathic medicine also, in terms of treatment, it's often adjunctive. So sometimes it can be alternative, whereas a patient might be coming, they're pre-diabetic, their doctor sort of gives them the choice to try to treat it naturally. So in that scenario, it's alternative medicine, meaning they're trying it as a first-line approach. But oftentimes, I'm actually seeing patients that might be already on a cholesterol-lowering medication, and they're coming for additional support so that their cholesterol medication doesn't increase with time. So that's another way how I work together alongside, I do checks like drug interaction checks to make sure any of the naturopathic interventions are safe with pharmaceutical interventions. So understanding high blood pressure. So high blood pressure, so now we're actually going to get into all of the conditions I listed out in more detail. We'll start with high blood pressure. So it's defined as blood pressure that is greater than 130 over 85, so 130 systolic over 85 diastolic or higher. We know that blood pressure increases the strain on heart and arteries, and this is because of the pressure and volume of the blood. There are many lifestyle contributors that can influence high blood pressure. So these are things like from a dietary perspective, it could mean like high sodium, so salt intake is important to consider. Stress, as we mentioned earlier, can play a big role, and then having a sedentary lifestyle. So the key to treatment for high blood pressure is to figure out, is there a root cause that's contributing to it, and then treating that accordingly. So this is actually one of my favorite slides in today's presentation because of how functional foods can help support high blood pressure. So we're actually going to go through all of these in a little bit more detail. I'm sure people have heard to eat a banana, it's good for high blood pressure, but I always like learning why a certain food is beneficial. So I'm just going to go through this list and really encourage you that if you have high blood pressure or even borderline blood pressure, definitely have a diet rich in all of these food items. So bananas are specifically helpful because they are rich in potassium, yes, but they also are helping kidneys remove the excess sodium. Avocados are rich in omega-3s, so from a healthy fat perspective, they're actually reducing inflammation in the body, so even at the arterial level, that's going to cause better blood flow. They also have high potassium content. Kiwis is often one that a lot of people don't think about for blood pressure. They are rich in vitamin C, so from a circulation perspective and from an inflammatory perspective, it makes sense for why it would be beneficial, but it also has high potassium. So kiwi is actually one that I encourage a lot of my patients, if they have borderline blood pressure, to make it part of their regimen. Oranges are rich in potassium. They're really rich in antioxidants. So earlier we talked about oxidative stress. So that plays a really big role in their vitamin C content. And together with the flavonoids, which are antioxidants, they improve blood vessel function. So through that mechanism, they can help lower blood pressure. Pomegranate is one of my favorites, and it actually works quite well, whether it's in like a pure, no sugar added juice form or the actual fruit. Pomegranate can have a significant impact for some people to lower blood pressure because it's rich in something called polyphenols, and polyphenols really help improve circulation in your body. And they can also reduce inflammation. Dark chocolate is often a favorite of a lot of people, which is nice because a lot of people don't realize, but chocolate, if taken in the right form, meaning if it's dark chocolate and higher than 70% of cocoa or higher, it actually is really beneficial for you. It's rich in magnesium, which is another reason why it's beneficial for reducing blood pressure. It's also rich in flavonoids, so it can actually help improve blood vessel function. Celery is another favorite one of mine. So I will often recommend patients of mine to make like a smoothie out of celery, orange, and pomegranate. And this combination together and adding it to your regimen, depending on what time of day suits you, is actually beneficial to keep blood pressure levels lower. So celery have natural nitrates, and we know nitrates are important because they're increasing blood vessel flow. So they're helping to relax the blood vessels, which increase blood flow, and it's lowering inflammation. Turmeric, which I'm sure everyone is well familiar, it can stain counters, but it can also be so useful for your health. And so curcumin is the active component of turmeric. And curcumin is, it can be, I'm sure many of you have also seen it in supplemental forms, but curcumin is really beneficial because of its effects on inflammation in the body. And through that mechanism, it's really supportive in supporting cardiovascular health. It's great for even pain management. It's great for immunity as well. Beans, in particular white beans, because they are very high in potassium, but I would actually say all beans are very helpful for high blood pressure because of their fiber content. Fiber can help reduce cholesterol. It can help support heart health. So definitely increase white beans and bean content in the diet. And then the last one is salmon, which has to do with the omega-3 fatty acids. So omega-3 fatty acids can help reduce inflammation in the body. They're important for heart health. They can lower cholesterol, and they can support healthy blood vessel function. So now that we've covered a lot of the functional foods, what are some other treatment options that I use in my practice or other naturopathic doctors use? So I'm sure some of you have heard about the benefits of hibiscus. So hibiscus tea, sometimes even hibiscus in supplemental form, is very, very useful. Hawthorn is another berry, and it's very useful. Oftentimes it's more in like a supplemental form, although tea form also is helpful. Garlic, so definitely using it in like the culinary sense, so using it in cooking is beneficial. But in this case, I've mentioned it specifically for the use of it through supplements. So garlic has an active ingredient called allicin, and allicin can actually help lower cholesterol and help lower blood pressure as well. And then coleus and rauwolfia, these are both herbs that are used in cases when some of the other treatments don't work. So they're a bit stronger, and then they have to be closely monitored. One thing I do want to mention is sometimes I have patients that are taking medication and then they're adding on these. You have to be very careful because there is a risk if you are adding meds with herbs that your blood pressure can fall too low. So it's so important to work with a healthcare provider or someone that can help you tweak the best time of day and monitor blood pressure levels. The other side shows other treatment options. So this is kind of goes back to what naturopathic medicine is all about. So addressing the root cause. So if, for example, sleep is a reason that is causing high blood pressure, then things like magnesium, lavender, passion flower, those herbs, for example, and magnesium as a supplement can be helpful to improve. Other options are ashwagandha and rhodiola. So these are adaptogens. So for example, if the cause of high blood pressure stems from stress, this discussion is very important to talk about how adrenal support can be beneficial to help reduce stress. And then if it's anxiety or if I want to help patients improve through promoting relaxation, then acupuncture and deep breathing exercises are also very important. The last point I wanted to make on this slide is definitely if there's a takeaway that I can tell anyone to try to do at home is if you don't have a blood pressure monitoring apparatus at home, definitely worth investing in one. It's so important to keep regular checks of blood pressure. It does not mean you have to check your blood pressure all the time. Discuss how often that's important with your healthcare provider. I know with some of my patients, if we are starting on a new regimen, like a new herbal treatment, I will get more frequent readings for blood pressure. But once your blood pressure levels are set, you don't necessarily need to do it that often. But I think it's so important to definitely have a device at home that you're measuring. So the better you understand your blood pressure, the easier it is to treat. So now that blood pressure is done, we're going to focus on the next diagnostic criteria, which was high fasting blood sugar. So this is defined as fasting blood glucose greater than 5.6 or HbA1c greater than 5.7%. HbA1c represents your blood glucose status for the past 3 months. So oftentimes this number is more helpful and useful for guidance because while fasting glucose kind of depends on what you might have ate the night prior, HbA1c kind of gives you the last 3 month range. So it is very useful. If you do have a fasting glucose greater than this value, then it's indicating that insulin resistance is going on in your body and you are developing prediabetes. We know that both insulin resistance and being pre-diabetic can contribute to more inflammation and vascular damage in your arteries and in your blood. So the long-term effects of untreated blood glucose, high blood glucose, can cause diabetes. And we know that there are so many complications that diabetes has. There is neuropathy when there is nerve damage. There is nephropathy when there's kidney damage in complicated cases. Retinopathy when there is eye damage. So heart disease is another big risk factor, and then weakened immunity. So if left untreated, all of these long-term effects of diabetes are actually possible. So testing HbA1c, fasting insulin, and fasting glucose every 3 to 6 months is what I usually recommend with my patients, especially if they're showing signs of prediabetes. Your healthcare provider might do something different, but that's okay. And one tip that I will often recommend, especially for patients to do at home, so if you have like a glucomonitor at home or if you have one of those shoulder patches that are kind of sort of tracking blood sugar, I always recommend for a couple of days, to really understand your blood sugar patterns, start by testing your fasting blood sugar and then 2 hours after meal. So postprandial means after meals. And this kind of helps you understand how your blood sugar is working and how your insulin pattern is reflecting the high sugar as well. So this picture, I put in the slides because we often hear about this word, and I've talked about it so much, insulin resistance, but what does it actually look like inside your blood? So if you look on the right side, you're seeing what a normal what it will look like in the normal process. So you're eating food in the stomach gets converted to glucose, and so it enters the bloodstream. And so pancreas is responsible for releasing insulin, and insulin's job is to help glucose be absorbed from the bloodstream into the muscle for use. So right here, you're seeing the glucose is being absorbed well with all these connections with the blue and yellow. Here in insulin resistance, what you can see is the insulin is actually not working very well. So you're not only seeing high amounts of insulin in your blood, but you're also seeing high blood glucose as well. And it's really not doing its job of creating this complex of glucose being utilized in the muscles. So what are some nutritional managements for high blood sugar and diabetes? So for diabetes, or if a patient is coming in and their blood work is showing that they are getting closer and closer to the 5.7% HbA1c, I'm really focusing a lot on diet. So I have listed a couple of key points that I do with my patients. One starting off with is balanced meal. So aiming for protein, fiber, and healthy fats at each meal to balance blood sugar levels better. I always recommend to avoid eating carbs alone so that you're not getting the glucose spikes. The second point is choosing low glycemic carbs. So these are things like choosing vegetables, legumes. So this includes beans, lentils, chickpeas, and whole grains such as quinoa, oats, and barley. And this is because these are all rich in high fiber. So the low glycemic carbs are wonderful because of the high fiber content. What I recommend to limit is refined grains because they increase the blood sugar spike. And then I always tell my patients to limit the 3 whites. So white sugar, white flour, and white rice. The third one, I think, is not only important for diabetes, but it's also important for cholesterol management too, and that's fiber. So increase your fiber intake. Fiber slows glucose's absorption and it improves insulin's sensitivity in the body. So choosing vegetables, seeds such as chia, flax, hemp seeds, sunflower, pumpkin seeds, those are all great options. Nuts, and oftentimes I'm actually recommending patients to supplement even with psyllium. And this is because in North America, we just have a low fiber diet in general. So I often recommend specific numbers. So I'll often go through like 28 grams in women is what's recommended for fiber, 38 grams in men. So try to increase fiber as much as possible. So the next point is, we touched upon it briefly, it is prioritizing protein. So protein, we know, can help stabilize blood sugar levels, and it can help reduce cravings. So the goal is to include protein at each meal. So for breakfast, for example, that can look like eggs. It can look like Siggy's yogurt, for example, or Greek yogurt, which is higher in protein. For lunch and dinner, it can mean meat, poultry, fish, lentils, and beans. So all of these can help increase your protein content for the day. Point number 5 is the importance of including healthy fats. Now, a lot of people think healthy fats are important for cholesterol, which they are, but I often will explain the benefit of having a diet rich in healthy fats for the purpose of management of diabetes. And this is because fats, they can improve satiety in the body, and they can increase the insulin response. So sources of healthy fat include olive oil, avocados, nuts and seeds, so walnuts, cashews, pumpkins, sunflower seeds, chia seeds, all excellent sources. And then other healthy oils are ghee and coconut oil. And then another great source of omega-3 in the diet is fish. I do often go through this topic of limiting seed oils, especially in cooking. With a lot of South Asian cooking, we're often using oils like sunflower oil or corn oil or even vegetable oil. So I will often explain that try to use the healthier oils to cook in, because that actually can play a big difference in your body. Timing your meals can also play a really big role. So eating meals at regular intervals, especially if you are pre-diabetic, and avoiding skipping meals, especially breakfast. Even having super long gaps can worsen insulin resistance as well. So try to avoid long gaps, especially if you are having, you are managing diabetes with medication. I think that point is really important. And then the order in which you eat a meal really matters. So I always explain the benefits not only to patients, but even with my kids. I will often tell them the importance of eating their vegetables first at the start of their meal. It increases satiety, it has good fiber content, so it really helps with blood sugar regulation. So another important point is being mindful of fruit intake. So a lot of people who are diabetic won't want to hear this because they think they're being told not to have, like completely avoid high sugar fruits, so things like mangoes, grapes, and watermelon, pineapple. These are all high sugar containing fruits. However, I always tell them, depending on what their blood sugar level is, you can have them in moderation. And it's really important to pair fruit with protein or fat, because when you are pairing it with protein and fat, you actually are improving the insulin response, and so there's less of like a spike and more of a plateau curve. Other good fruit options are the low glycemic fruits, meaning fruits that don't really create a glucose spike. So things like berries, because they're really rich in fiber. Kiwis, we talked earlier about it, even for blood pressure support. And then apples and avocados. These are great fruit sources that you can have in your diet. The next topic is avoiding the blood sugar spike. So simply reducing things like pop, fruit juices in your diet can make a really big difference. Really limiting and controlling desserts can make a big difference to your blood sugar spike. And then avoiding frequent snacking with highly refined carb meals or highly refined carb snacks. That itself can actually help reduce the glucose spike. I always explain that it's always better, if you are like a juice person, it's better to get it from the whole fruit versus drinking juice, because at least with the whole fruit, there is more fiber content. The last point here, and it's an interesting one because when I go through it with my patients, a lot of them don't realize how important gut health is for the management of high blood sugar. So this is things like really focusing on improving the gut microbiome. So this is probiotic-rich foods, probiotics. So probiotic-rich foods are like things like yogurt, kefir, kombucha, fermented vegetables. Those are all rich in probiotics. And then sometimes there's even an opportunity for supplements. So in this case, this is where I will often talk about like apple cider vinegar. Because of the vinegar and the fermented nature of apple cider vinegar, it actually can help dampen the glucose response or the high blood sugar response. So there is a lot of, this is like a growing area, and there's a lot of focus that you can do for gut health. So I added these graphs. I'm a really big visual person, and even with my patients, I find that instead of just explaining, it's always nice to show like a graph picture. So what this graph shows, it shows the effect of certain foods on your blood glucose. So for example, with the first one over here, what happens to your blood glucose when you're having a diet such as bagel with cream cheese and orange juice? So you're seeing this like, this like slope that's like going up and then it's going down quite quickly. Whereas if you were to have a diet, if you were to have a breakfast that's rich in something like omelet with mozzarella cheese, so in here you're getting protein and fat, there's not that big of a spike. So what we're trying to look for, what the goal is to have more of like a plateau pattern. The second graph shows what we talked about earlier, which was the order of your meal matters. So for example, the first graph shows a pattern of your blood glucose when you're having pasta first and broccoli second. So similarly here, we're seeing like that spike in blood sugar and then spike in insulin that would follow thereafter. And here, if you're having the broccoli first and the pasta second, you kind of see a lower curve and more of this plateau pattern. So this is the goal that we want. And simply changing the order of your meal can actually improve your blood sugar response. The third graph is one that we also talked about, which was the importance of pairing fruit with like healthy fats and protein. So if you have a banana alone, banana can represent any fruit really. So if you're having a banana alone, you're noticing a blood glucose spike a little bit higher. Whereas if you're pairing it with peanut butter or some nuts and seeds, for example, which are rich in healthy fats and protein, we're not seeing that spike, we're seeing more of the plateau. So the plateau is good because the more plateau that you have, there's less insulin spiking. And that's essentially what we want to not worsen insulin resistance. So similar to the other slide, these are functional foods that can help support high blood sugar. So bitter melon is a very common one. Bitter melon can be both in like supplemental form. It actually can be in food form as well. I sometimes even go through and talk about bitter melon juicing for some of my patients. Bitter melon can actually reduce and improve HbA1c. So definitely have a lot of bitter melon part of your diet. Chia seed pudding is one of my favorite options for a lot of my patients, not just for diabetic patients, and it's because it's such a good food option. If you're making it with like yogurt, it's easy because you get to make it the night before. You can add berries on top and nuts and seeds on top, so it's a very wholesome option, and it can help, because of the fiber content, it can really help both with blood sugar regulation and help reduce cholesterol as well. Prickly pear is a really good option. There is a lot of research that talks about how it can improve fasting blood glucose. Nut butters and nuts and seeds, they're rich in omega-3. They're good sources of fiber and protein. So through that mechanism, it can help high blood sugar. Cinnamon, specifically, I like talking about Ceylon cinnamon. So there are two types of cinnamon, cassia cinnamon and Ceylon. Ceylon cinnamon is the one I recommend for blood sugar regulation. This can be either in like supplemental form or be added to herbal teas, or even just used sprinkled over food like oatmeal. Chia seed pudding, for example, is another good option of how you can add cinnamon in. Berries, because of their polyphenol content and their fiber, are very helpful. They don't actually create blood sugar spikes, so berries is an excellent option. Tomatoes, because they're rich in antioxidants, it's another really good option. But specifically, there's a nutrient in tomatoes called lycopene, and lycopene actually can help reduce the fasting blood sugar. So there is a direct benefit. Avocados is because of their omega-3 content and they're rich in healthy fat. So that is why that is really beneficial. Nuts and seeds, we talked about earlier, fiber and fat, healthy fat and fiber. And then lastly is turmeric, and this has to do with the benefits I mentioned earlier with the anti-inflammatory effects. Apart from diet, there is a big room for supplements that's very individualized to each person. Supplements can range from anything like fiber. That's often one I'll add as a supplemental form for my patients. Berberine is a very common one. I'm sure many of you have heard it. Maybe some of you are even taking it. Berberine can help reduce HbA1c and has positive effects on lowering fasting blood glucose as well. Gymnema is an herb, and it's actually helpful because it can reduce sugar cravings. So it is beneficial for some patients. Chromium is a nutrient involved in reducing blood sugar. Alpha lipoic acid can help reduce. It's also a nutrient, and it can help lower HbA1c and have positive effects in lowering blood glucose. Cinnamon, this is in supplemental form, so a lot of these supplements you might find at health food stores often have cinnamon already added in their supplement, and this is because of the benefits for blood sugar regulation. Fenugreek could be either just taken it in like the herbal form or in the supplements, and then bitter melon is another common one where people will end up trying for supplements if they're not noticing a positive response from just diet and lifestyle alone. And then there are just key nutrients that we look at that are important for blood sugar regulation. So vitamin D is an important one, and it's very important for Canadians because of how deficient Canadians are of vitamin D. So vitamin D is important not just for bones, but it's also important for insulin function. So I find this very interesting. So if you are low in vitamin D and you're noticing your HbA1c is increasing, well, then you know there's definitely a room where you need to supplement. And hopefully that can also improve the HbA1c response as well. Magnesium is essential for glucose processing, so that's sometimes another important nutrient I will often supplement for my patients. Omega-3 fatty acids, not just for the benefits of diabetes, but also for the benefits of reducing inflammation and improving metabolic health in general. And lastly, zinc, because it's important for insulin signaling. So it's always great to see that there are options that we can consider in case diet and lifestyle aren't strong enough to lower blood sugar levels. So lifestyle is another key part of management. Even doctors I know are really big on encouraging resistance training exercises and exercise in general. So some of the specific recommendations that I share with my patients is to avoid sitting right after a meal. So what is recommended is after a meal for 10 to 15 minutes, do some form of light activity. So this can mean like walking or a seated calf raise. Seated calf raises are actually a really, really good option that you can consider. And what it does is the soleus muscle in the calves can actually be effective for reducing blood sugar spike because the muscle is engaged and it's absorbing the glucose. So oftentimes it's something simple. You can sit at the dinner table after you're done, but focus on doing the seated calf raises, and it can represent a better blood sugar response. Resistance training, so making sure you're using your muscles obviously can help improve the blood glucose control in the body because the muscles are utilizing more of the blood glucose from the blood. And it's recommended 2 to 3 times per week. And the other reason why it's important is the more muscle you're using, the less muscle loss you'll get. As we age, there is a muscle decline, so there is added benefit of using it for resistance training. So the next part of the diagnostic criteria was understanding high triglycerides. So triglyceride is a type of fat in the blood that the body uses for energy. Excess triglyceride raises risk for heart disease, and excess sugar gets converted into triglycerides. So that is why I added this picture of the liver, and what you can see here is so on its own, through the regular fatty acid metabolism, the way the body utilizes fat, you are going to get increase in triglycerides in the blood. However, if there is excess glucose in the bloodstream, it also is going to enter this pathway and increase risk for triglycerides. So this one is directly linked with blood sugar regulation. So some naturopathic treatments for high triglycerides is reducing sugar, reducing high saturated fatty meals, and increasing omega-3s in the diet. So increasing omega-3s not only improves or lowers triglycerides, it actually improves the overall cholesterol panel, and then fiber, as we touched upon earlier, because it really does have that effect on reducing cholesterol and reducing triglycerides. Exercise can actually also reduce triglycerides, and it has to do with the same involvement of the blood sugar control. So if there's not excess blood and the blood is being utilized, the chances are it's not being converted into extra triglycerides. So exercise can definitely help. And then here, sometimes there is an opportunity for supplements, and that can be different things. That can be things like fiber. It can be omega-3s. It can be things like plant sterols and beta cytosterols, which can be helpful for reducing not just triglycerides, but also LDL cholesterol. Red yeast is very effective in reducing both triglycerides and LDL cholesterol, which is the bad cholesterol. Bergamot is a very popular one nowadays, and bergamot supplements are being actively studied for its benefits in reducing all of the cholesterol panels. So it can improve the good cholesterol and it can lower the bad cholesterol. CoQ10 is also on the list, and CoQ10 is such an important nutrient for heart health. So if I have patients that have high blood pressure, high cholesterol, if they're diabetic, or as they're getting older. So if they're above the age of 45, it's always a discussion to talk about CoQ10. CoQ10 is a nutrient that's naturally found in our bodies, but as we age, it actually declines. CoQ10 is really important for heart health because as you decline, you're actually reducing how much CoQ10 is actually at the cardiac level. So CoQ10 is a nutrient, especially if you are on medication, for example. A lot of cholesterol-lowering medicine, like Crestor, for example, can reduce CoQ10 in your body, and one of the symptoms of that is calf pain. So if patients are coming in and they're noticing calf pain, and I look and I go through that they're on Crestor, then it's a room to definitely supplement with CoQ10. The next one is understanding HDL. So HDL is the good cholesterol in our body. In metabolic syndrome, one of the risk factors is when there is low HDL. So if you have lower levels lower than 1.0 millimoles per liter in men and less than 1.3 millimoles per liter in women, you are meeting the criteria for having low HDL. Low HDL is linked with impaired ability to remove plaque. So I like this picture, and I always show this to my patients as well. We always talk about good cholesterol, bad cholesterol, but what does it actually do in our bodies? So if you look over here, the good cholesterol is HDL. And you notice here, there is no plaque formation. Blood is flowing easily. So the good cholesterol is involved in that ability to remove plaque. LDL cholesterol right here, which is also known as bad cholesterol, is really involved in plaque formation. So this is why we call it bad cholesterol, because of its ability to build up plaque. So what are some naturopathic treatments to help increase your HDL levels? A lot of that has to do with dietary interventions, so things like healthy fats in the diet. So olive oil, nuts, almonds, cashews, pistachios, walnuts, excellent sources of omega-3, seeds, so sunflower, pumpkin, avocados, and fatty fish. For fatty fish, I always recommend wild whenever possible. And then things like trout, salmon, mackerel, sardines, those are excellent sources of omega-3. Exercise and losing weight can actually improve your HDL levels, which is wonderful. So a lot of times people think like they have low HDL, they need to supplement. Yes, supplement maybe an omega-3 will be beneficial, but exercise can actually help. And it has to do with the fact that you're improving circulation and you're reducing plaque. So exercise is very, very important, even to help increase good cholesterol levels. And then supplements, there is an overlap with a lot of the stuff for triglycerides, and those are things like omega-3. Niacin or niacinamide, which is vitamin B3, is also a supplement that's often prescribed to help reduce cholesterol and increase the good cholesterol. Plant sterols, and then CoQ10 is also on the list for the same reasons I mentioned earlier. And then fiber. Fiber can reduce the bad cholesterol and help increase the good cholesterol. And this is the very last diagnostic criteria, which is understanding abdominal obesity. So this is when the waist circumference is greater than 102 centimeters in men and greater than 88 centimeters in women. Abdominal obesity, or the central fat, is linked to insulin resistance. And this is because adipose tissue is basically like the fatty tissue is storing excess sugar because it's converting it into fatty acids. So that is how, like, over time, abdominal obesity can actually get more and more, and your waist size can increase. And so there are many causes for abdominal obesity. So weight gain is like a big one, which could be due to a low physical activity. It can be due to low metabolism. Aging on its own, we know metabolism slows, so that can increase, weight changes. Hormonal changes, so these are things like, low testosterone in men, for example, can really increase the risk for increasing abdominal obesity. And then in women, in menopause, there's a big shift in estrogen and progesterone balance. And that is a very common time for a lot of women to notice a big increase in weight gain. Chronic stress, we touched upon it earlier, but chronic stress actually is very much linked with increasing abdominal obesity, and this has to do with high cortisol. So cortisol is normal, like I mentioned earlier, but when it's chronically high, it is going to influence weight gain. It's almost like your body wants more cortisol around or more fat around so that you can keep up with your high stress demands. A lack of sufficient sleep is actually very much linked. So a lot of times when there is patients who are going through different weight loss regimens and it's just resistant, we're not noticing results, oftentimes improving sleep can actually help shed pounds. So there is a big link with sleep and abdominal obesity. So some naturopathic treatments that I will often talk about are things like diet and lifestyle to promote weight loss. I really try to figure out what the cause is of the weight gain. So these are things like, for example, if there are sleep disturbances, I'm talking to patients about magnesium. I'm using herbs such as chamomile, valerian, passion flower, lemon balm, for example. If the root cause is stress and there's high stress, then things like adaptogens, which are help basically the cortisol response in the body. So those are things like rhodiola, ashwagandha, holy basil. Those are wonderful options to consider. We know that B vitamins, so like all the B, so B1, B2, B3, B6 in particular is also very helpful. B12 is in particular is very helpful to help reduce stress and manage stress levels. And then again, the whole omega-3 through its effects of reducing inflammation and improving the stress response. Hormonally, if the issue is like, let's say it's like a woman is in perimenopause or menopause and there's changes to estrogen and progesterone balance, addressing that is going to be an important part of the weight loss picture. In men, low testosterone can influence weight loss. So the point is to really look at what the root of the problem is and address that. Metabolism as we age often gets slower, and so there are other options such as MCT oil, which is made from coconut oil, B vitamins, using green tea, whether in supplement form or in using it in like tea form, and cinnamon and ashwagandha. So these are all ways that we can increase metabolism. So managing metabolic syndrome. As a summary, we talked a lot about nutrition. So these are things like anti-inflammatory foods, using whole food diet that is rich in fiber, protein, and healthy fats. Focusing on really improving sleep. So 7 to 9 hours per night of sleeping is ideal. Obviously, from person to person, that number can vary. Everyone has like an ideal sleep that is specific to them, but it's not just how many hours you are sleeping, it's also the quality of sleep as well. So working on ways to improve sleep is a great option. Exercising, so the recommendation is around 120 to 150 minutes per week of moderate intensity activity. So this could be in form of like walking. A lot of times people are using weighted vests to help support, a good calorie burnout. Resistance training, because you're using weights, and weights can help with blood sugar management, and high intensive interval training if appropriate. So it's not something that can suit everybody, so figuring out which exercise regimen works for you is important, but my key message is definitely exercise and try to meet that 120 minimum goal per week, because movement really is medicine. Stress, so chronic stress really does cause elevated cortisol levels, or elevated cortisol really does contribute to insulin resistance. So things like doing mindfulness, I think our salah as Muslims, it's amazing, can really help with that as well. The power of deep breathing and breath work is often overlooked, but it's so important. And then using like herbs, like adaptogens can really help. And then exercise as well can reduce the stress. So I actually added this slide at the end of my presentation as well to really show how interconnected everything was. As you saw earlier, I was mentioning triglycerides, but I was also talking about insulin resistance. I was talking about abdominal obesity, and I was relaying that back to sleep, for example, which is related to like high chronic stress. So all of this is very much related. And the reason why it's so important, because it's so interconnected, if you, for example, have one of these things, let's say you're somebody that has high blood pressure, well, you want to really recognize and hopefully do all the strategies you can to prevent all of the other stuff so that you don't end up developing metabolic syndrome. I just wanted to show a case study. This is a patient of mine, and I thought it was really amazing to see how things like diet, lifestyle, and naturopathic interventions can make a big role in improving. So this is a 38-year-old male patient of mine. He had high triglycerides, high cholesterol, low HDL, and he had borderline high blood pressure. And so these are some of the markers we were looking at when he came in. So cholesterol is high, HDL is low, triglycerides are actually very, very high. So I don't know if you guys remember it earlier, but that range was like around 1.3. So this is almost 7 times higher than what the normal is for triglycerides. And his blood pressure was borderline. And then we started on a whole bunch of interventions. A lot of it was diet, lifestyle, there was supplements. A lot of it was like just lifestyle coaching, talking about the importance of improving sleep. 1 year later, the blood work was actually really great to see because cholesterol dropped. Still a little bit higher, but it did do a jump, which is nice. HDL increased. It's still not at the level of what we would consider normal, but it's still a big increase. And triglycerides, this was my favorite part, it's significantly lowered. And the amazing part was, through all these naturopathic interventions and dietary and lifestyle changes, his blood pressure improved as well. The last thing I wanted to touch upon are just practical takeaways. Limit processed food and sugary drinks in the diet. Get blood work done. I think I can't stress this enough with patients that I see. It's so important to be on top of your health. The only way you'll know what's happening inside is if you are doing routine blood work and making sure you're tracking progress. So even if you've done blood work and then let's say you've started on a treatment, make sure you do blood work after the treatment to see, has the treatment even made a difference? So it's not just for monitoring, it's also a diagnostic tool to see if treatment options are working. I also wanted to stress it's so important having diagnostics tools ready at home. So these are things like blood pressure monitor, having a glucomonitor at home as well is very useful so that you can track changes and pick up on risk factors. You know, there might be a random day where you're feeling like you're having a headache and you're consistently checking your blood pressure and you're noticing, well, blood pressure, like the diastolic, the lower number is higher, for example. So by having it at home, you really can be on top of your health. Metabolic syndrome is common. We know that it's rising. It's 1 in 4. But if you do it, if you do simple things, it can be reversible for some people. So small, consistent changes can make a big difference. And early detection and lifestyle are so key. I capitalize this because I can't stress this enough. Naturopathic medicine really focuses on prevention. So prevention really can help reduce your risk factors and complications for other complication parts of disease. You have the power to take control of your health. Thank you so much for listening, and if anyone has any questions, I'm more than happy to answer. Oh, I'm so sorry. Oh yes, that's such a good question. So intermittent fasting, research has shown intermittent fasting is actually has really positive effects on both fasting blood glucose. It can actually improve even the cholesterol and cholesterol management perspective. The important part with intermittent fasting and even fasting, like the month of Ramadan is coming, so that's another topic, but even in the month of fasting and Ramadan, I think the most important part is if you are doing intermittent fasting or fasting Mondays and Thursdays, what you're eating is really, really important. So making sure you're having a diet rich in healthy fat, fiber, protein, especially in both suhoor and iftar, can help, increase those levels improve those levels that we're looking at. Sure.
That most of us, we are having healthy diet.
Right.
Then your research actually put us on like the bad diet, like you use oils and all that, right?
Right.
And most of these people, the seniors, they used to have like less fat and all that, like butter and all this.
Right.
So I mean, is this any mafia here? Because when you go to a doctor,
Right.
he will never recommend any proper diet. Say eat whatever you want to eat.
Yeah.
Whereas in India and Pakistan,
Right.
you see the doctors say, don't eat this, don't eat that.
Right. Yeah.
So is it like by default or like they are trying to support those mafias who are selling oil?
It's a very good question. I think you addressed one thing, and I see this a lot with my patients where they've been going to a doctor, and the doctor will quickly give like a medication instead of focusing, even in prevention, instead of focusing on diet and lifestyle, they'll often do that. So I think from that angle, like naturopathic medicine is really big on prevention. So in our case, we will always start with diet and lifestyle. As far as the industry for like food marketing goes, there is a big component. We do know, obviously, like the whole sugar industry or the dairy industry, and the way the marketing works to really encourage people because of money. I do think there is. I think awareness is definitely increasing as well on healthy fat and health. Sorry, I lost my train of thought. I think the awareness is increasing though. The other thing I wanted to address why, and you mentioned this point about, in Pakistan and India, or like, our parents' generation or even older, their physical activity was so much more than what we're seeing now. Like that lifestyle was a lot more active. Here, there's a lot of more sedentary lifestyle. So I think it's a whole bunch of factors that are probably, in my opinion, at play. All right, thank you everyone for listening.
Hello. Assalamu alaikum, everybody. Hello, hello, hello. Oh. Hello, hello. Can you hear me? What?